Confident Stock podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Welcome to the Confident Stock Podcast. I'm Dr. Rednam, and I'm a board-certified plastic surgeon in Houston, Texas, with my Houston Surgeons, also known as the Confident Stock. Today, we have a very special guest. I have Dr. Natalie Crawford, and she's a board-certified reproductive endocrinologist. And Dr. Crawford is someone who's been working tirelessly to really educate not only patients, but the community on the importance of her work. So thank you so much for joining us on the podcast today.
Thank you so much for having me. I'm thrilled to be here.
So, Dr. Crawford, tell our listeners a little bit about what does it mean to be a reproductive endocrinologist?
Yeah, that's a great question because that's a whole lot of a mouthful to say out loud.
Yes.
Really, what we call it as a fertility doctor. That's how I explain myself. But when it comes to training, as you know, a lot of people, especially online, can call themselves one thing without really their full credentials. So to really be a true fertility doctor or reproductive endocrinologist, that means completed 4 years of OBGYN and then 3 years of specifically endocrinology and infertility training in order to be the master of the reproductive hormones and fertility.
And how many people are in your specialty, right? So it sounds like a lot of education and it's very specific.
There are only about 40 fellowship spots a year. So the new entry into the field is very small. And so even though there's a ton of OBGYNs who are out there, it's actually quite competitive. And there's a lot of research, very similar to kind of what your experience probably was. But you have to know you want to do it well ahead of time, have to have research and, interview and travel all over the country in order to match into one of those spots.
And for your specific specialty, who are the people that come to you? Who are the people to read? I think that everyone has an idea of like who goes to a fertility doctor, but I think it's much, much broader than what the average person thinks.
Definitely in modern practice, and I own a practice here in Austin, Texas, the vast majority of what we actually see day to day is either infertility or fertility preservation. So I'm trying to get pregnant, I'm having trouble, or I want to test my fertility, or potentially I want to freeze eggs or embryos because I'm purposefully delaying either out of choice or, for example, if we're undergoing cancer treatment or we have some medical problems. However, we also see patients who maybe just have irregularities of their hormones like PCOS or who have amenorrhea, meaning absence of periods. I see women who go into premature ovarian failure. So the youngest patient I've ever had essentially in menopause, she was 16. So we see patients really across the reproductive spectrum for a variety of hormonal issues. Although, yes, the vast majority of what we do every day in and day out is infertility.
And then how has it changed, right? As our knowledge, obviously, of this area has gotten better, a lot of things have changed in what access people have. So how easy is it for somebody who falls into those categories who does need your assistance to get to you?
That's a wonderful question, and it's changed immensely. I've been out of training for 10 years, and it's really different today than it was even 10 years ago. And the 10 years prior, the field has changed. So we just have to think about IVF as still a relatively new technology. This field is older than IVF, though. It used to be a very surgically heavy fellowship and specialty. And, I got trained in a lot of surgery, and that's kind of easing away as what I do day to day. Also, though, I think what we have seen is a great shift in the field as far as fertility awareness and education and patients being curious about their own fertility, wanting to be more proactive, understanding that there's issues and trying to come in and see a fertility doctor a lot earlier in the journey. We used to see, insurance really prohibit covering any evaluation before somebody had the definition of infertility, meaning trying to get pregnant for 12 months and not having success if you're under age 35. And that was really limiting because what if you just wanted to freeze your eggs? Or what if you had really irregular periods? And so a lot of patients fell between the gap. And unfortunately, one thing I do see nowadays is a lot of people still think that that is the case, meaning like, oh, I can't go see her, I can't go see a fertility doctor until I've had this failure of X, Y, or Z. But the reality is, there's a lot of circumstances where patients should just schedule an appointment off the bat. So if your periods are irregular, or if you are getting older and purposefully delaying your family and you want to get testing, if you're trying to conceive and you've got known issues that you were diagnosed with in the past, like PCOS or endometriosis. These things are all really important that we can do a lot earlier testing and counseling based on your goals, how old you are, and your desired family size.
And when, I know one of your focuses has really been that your daily choices affect your fertility more than you know. Can you speak a little bit more about that?
Absolutely. So for a long time, there was kind of this idea that your fertility is just luck, right? Good luck or bad
Hmm.
luck, that there's no reason to worry about it until you're ready to have kids. And people would be doing this complete 180 shift, right? I'm preventing pregnancy on my birth control. And then suddenly we'd be in a position to say, oh, I want to get pregnant. What do I do now?
Hmm.
I approach this and say there's kind of a few things to know really upfront. One is that rates of infertility are increasing. We also know that your fertility is a health marker, meaning if you have infertility, you are at risk for future disease states. This tells us that a lot of the underlying causes of infertility are things that are on the disease causing pathway tied together by chronic inflammation. And I always try to refocus and say, if you really want to take charge of your fertility, what we're looking to do is one, be aware of our body so we know those red signs earlier, know what's normal so we can know what's abnormal, consider getting earlier testing. I mean, my
Hmm.
dream would be that the whole field kind of shifts and pivots and it's a more proactive approach. Like, oh, do you want kids one day? Well, let's test what we can. Let's come up with a game plan. But really, if we kind of have this idea that we know inflammation, chronic inflammation is very toxic to the body. And you know this, I know this. There's so many things that can cause chronic inflammation that we are exposed to on a day-to-day basis versus, some disease state in our body. Meaning the
Hmm.
things that we eat, what we put in our body, our stress levels, how we sleep, all of those little choices over the period of years and decades, they add up to the wear and tear of our body and they impact our hormonal health and our fertility. So understanding this can sound scary sometimes, but really it's, I think, a way for us to take control of something that sometimes feels like it's a little bit of out of control, saying, well, maybe I'm not ready to have kids yet, or I don't have my perfect partner and I want to wait for that. But I can control my health and know that I'm taking good care of myself. Know I'm mitigating the factors I can. I can get an evaluation. I can understand my body. And at least I can be the one making these decisions and choices because the truth is, with our fertility, time will make a decision for us if we don't, right? Inaction is an action, it is a choice. And I'm trying to switch that so people feel more empowered to have the data they need to make choices along the way.
I love that. And I actually think that's a general shift that we are hopefully seeing across the board of medicine right now. While we do different types of, procedures, even in what I do, I like the idea of us being more proactive and preventative. We don't have to wait till we're at our 70s and say, "Hey, I need to do all these things to make
Right,
myself
like
feel
a
away."
facelift. We see people
Yeah.
kind of talking about their skin health a lot earlier and not just trying to fix the end problem, but improve the integrity of it based on what you're doing day to day. So I don't know about your field, but mine for a long time, there's been this idea that, well, it doesn't really matter what you do in your lifestyle because IVF is just going to take care of it in the end.
Hmm.
And there's definitely people who say that, and that feels very belittling to a lot of patients, but it's also just not true, right? We know skin integrity, we know your whole body health, it's all connected. And so you can make a meaningful difference in your entire health span, right, across all organ systems, but that definitely does include your hormones and your fertility.
And you said earlier that, we're seeing an increase in this. Do you feel that the increase that we're seeing in infertility rates are because of these lifestyle changes, or do you feel like there's other factors as well?
I think the lifestyle that we lead, the current environment, so part of it is choices we're making, part of it is the world that we live in, and things that have become normalized, right? Toxins
Hmm.
that are in our world that are normalized, or toxic behaviors that people do all the time without really realizing that they're so bad for them, the standard diet. these are a huge reason. We definitely know, yes, people are waiting longer to start families, but when we see an increase in disease across the board, an increase in autoimmune disease, the same time we're seeing an increase in infertility and decrease in sperm counts, decrease in egg counts, decrease in egg quality. It's not just, oh, isn't that coincidental? It's really all tied together and connected. And this is why you have to take an active role in taking charge of this. And I think as humans, sometimes we have this all or nothing mentality. Well, I'm not going to do all those things that she says, so I'm just going to do none of them. And what I try to impact on my patients, I say, hey, this is just knowledge so that you can choose. Granted, every single decision that you make in the good fashion that's decreasing inflammation, the sum of those choices really do matter. And of course, if you could do them all, that would be awesome. But it shouldn't be this, oh, I can't do it all, so I'm going to do none of it. We've got to give ourselves grace because we know how life is, but really understand that we do make choices every single day, and some of them we just don't even realize how harmful they are. A great example is sleep, right? A huge portion of Americans do not sleep more than 6 hours a night. And we know that sleep is when your body heals inflammation, it's when it resets, it's when your cortisol lowers, and if you're not sleeping long enough, you're starting the day already in a deficit every single day.
And I also like this way of thinking. It's very empowering, right? Like you can help, you can take control of some of these things. We're in charge of our diets, we're in charge of what we do. And so it maybe takes something that can be a really difficult situation for someone and put a little bit more control back in their hands. S-
Yeah, I mean, absolutely. When I had my own infertility journey, when doctors told me, oh, there's nothing you can do, it's just bad luck, that's one of the worst things
Mhm.
to hear. And even if it was reframed and say, well, you can't control everything, but here's some things that you can, focus on doing that's going to improve your body so that you have the best odds of the next pregnancy working out. That would have been really helpful and empowering to hear and good for me versus the narrative that I heard.
And I know that you've been some very exciting news is that you actually have a book coming out where you're putting a lot of this wisdom. So tell us more about your book.
I thank you so much for bringing this up. The Fertility Formula I feel like it's my third child because it is my debut book that I've been working on for over 5 years. What's so ironic is I've been talking about fertility on the internet for almost a decade, really always been very passionate about natural fertility and helping people understand their bodies and understand these lifestyle choices. And I was told over and over again that there's no interest in a fertility book and that it's too depressing of a topic to talk about, which is just hard to hear. And I kept thinking, well, I keep talking about it online and people keep following. So I just kept sending the book out there. I was told to change it in different ways and luckily finally found an agent who believed in it. And it's crazy how fast things start happening then because she had a book deal for the book within 3 months. And so just things started happening so quickly. So it is coming out in spring of 2026. It is available for pre-order right now. And it really is covering all the stuff that we just said. It's divided into four main parts. So it's going over the fertility facts, I wish everybody just knew about their body, hormones, menstrual cycle, age, how inflammation plays a big role. Then it goes over getting to the root cause of abnormal cycles. Well, how do you track your cycle? What should you know if you want to get pregnant and what you should know if you're struggling with infertility? And then parts 3 and 4 are my favorite because that's really diving into all the literature and the data that exists on the different lifestyle aspects and how they impact inflammation and fertility. So, stress, sleep, exercise, nutrition, and toxins. And then in part 4, giving it all an actionable plan. So, it's not just facts being thrown at you, but giving you something that you can do on a day to day basis. What am I going to do with this info? And I really poured my heart and soul. It's, years and years of work. And I'm so excited. And because the irony of a fertility book being available for pre-order 9 months before it's actually available is not lost on
That's,
me, right?
that's
It's kind
funny.
of crazy. So we did create some pre-order bonuses. So if you're interested right now, if somebody pre-orders it, they can go to nataliecrawfordmd.com/book. We've put together a 30-page hormone lifestyle guide where a lot of the stuff that we're talking about here will be given to you. And then there's also access to my IVF course. So if you're going through IVF, the book is still very applicable to you, but giving you a little tidbit because I know you want answers and help now. So I'm so excited about it. And just to be really opening this discussion about fertility. And I feel it is not a depressing topic, but it's an empowering one. It's a truth for all of our bodies. understanding our hormones, how they change in different life stages, that's not something to shy away from and not talk about. It's something to say, hey, I know this, so now I'm more prepared for what's to come.
I think that's so, yeah, it's like so ironic that they're like, oh, that's depressing. I think it's hopeful. Why is it depressing? Like we're talking, I mean, I know sometimes that when it comes to women's bodies, apparently everything about us is depressing or mysterious, but like I think it's amazing. I think that, you know, the more educated we are on how our bodies work, the better we can understand what's going on, the changes when we want to address them. So congratulations. That is a big deal.
Thank you so much.
And you are, that's not your only thing. You know, this book, for our listeners is just one of the many, many things that Dr. Crawford does. She is a entrepreneur. She is a mentor. You are a podcaster yourself. How did you first decide, hey, let me give this a shot? Like, I want to start sharing this information more.
That's such a great question. I started on Instagram way back in the day. Like I'm aging myself. So it was in 2016, I opened an account to talk about natural fertility online and just thought, maybe I'll kind of trick somebody into learning something about their body, give them a little information that will help them change the trajectory of their course. Because I really felt like I was seeing women every single day who were successful, smart, and I was the first person who was ever telling them these facts about their body. And there was this shock, almost this paralyzation where you couldn't make the next choice because you couldn't believe the information that was coming in. And I kept thinking, if I could educate people earlier in this journey, then at least maybe they could play a more active role in knowing this and making choices that are right for them, whatever their fertility journey looks like. So that got me on Instagram. And I was on Instagram for years. I started my podcast in 2019 because I felt like the transient nature of social media, I was being asked the same questions over and over. And some topics I really wanted to dive deeper into. So in 2019, I started the As a Woman podcast in my closet. So, very like, if you want to say,
It
hey,
was an intimate studio. So,
very intimate with my clothes behind me and everything. But I watched YouTube videos about what to do and edited it myself and got it out there. And it really resonated. It's wild now because it has over 6 million downloads,
that's
and
amazing.
it's it's crazy. And we finally upgraded and like took it into studio, and it's video now. It's not just me in the closet. But it's been very, I don't know, very fulfilling to connect with people in such a meaningful way and to hear them say how the podcast, gave them information to go ask their doctor different questions or to feel like they had this fund of knowledge to understand what was going on. Because infertility is isolating, it's scary, it does feel very out of control. And even in the perfect scenario, we don't always have success. And so, one thing I always try to frame is that what we can control is how the journey goes, meaning that you felt like you knew what tests were being ordered, why we were doing these, what we're going to do with the information. You felt good about the choices we were making. You knew you were controlling everything that you could. So, you could put faith in me or your care team that we were doing everything we could. And that goes a long way. But so often, people would have no idea, sadly, right? Like we know not all doctors are created equal. They would show up at the clinic, they would be going for ultrasounds, and they had no idea what was happening or what was going on or what they were looking for. And even if they asked, they weren't getting answers that really made sense to them. So trying to, level the playing field so that people could come into these appointments, which are really scary and high tech and big words, with a baseline fund of knowledge that puts them at a place where they know what they're looking for and what questions to ask. So it has truly floored me. I never thought the podcast would be what it is today. And it is so meaningful. Every single person who listens and shares. And, it's like the people would give what I say is their most precious commodity, their time to listen
Mhm.
to your voice and spending time with you is so impactful.
And I think what you said is really important is now people have access to, not, like you said, not every doctor is the same and not every doctor is available where you live. And now people have access to an expert from the comfort of wherever they're at, right? And so that's really opened up to where now more people are able to get the right type of education. That being said, there's also a lot of other education that comes out there when, especially in your specialty. How do people help figure out, like, what's good, not what's bad? How do they determine that on all the stuff that's out there?
I never imagined when I picked this field that it would be one of such high controversy all the time. That simple things like birth control pills and progesterone would cause this huge online commotion. And it is really hard, and this is something that I go around and I give talks, at my national meetings for our society because I always get this scuffle about, oh, social media. And I get up and I show slides of people's Instagram profile page that say hormone specialist, fertility expert, and go through, and I say, none of these people are us. None of these people are REIs. None of these people are even physicians. But if you are the consumer, this is what you're seeing. And you can see how you think these people are experts in what they say they are. And then when you put up some of the posts that they are sharing, things that are not true, like that EBV causes PCOS and fibroids, or that folic acid causes miscarriage. People in the audience are floored that these posts have, millions of views because controversial health information is extremely sexy and it sells. What I tell people is that if you're a consumer trying to consume information, number one, what are the credentials of the person telling you this information? Because if it's not very clear, you should really think twice. I have no problem with people who are not physicians posting health information. There's tons of information to learn from nurses and PAs and chiropractors and acupuncturists. Everybody has a place and has a different level of expertise, but we should all be proud of those credentials and putting them in clear space for somebody to see. So when somebody says they're doctor hormone expert, yet there's nothing to back that up, that should be your first red flag, because somebody who's providing health information that we know over 80% of Americans are using that information they find on social media to help make health decisions. You need to know, what are the credentials of the person giving me this information? Are they somebody I can trust? And then the other thing is, if it sounds too good to be true, or if it sounds like the opposite of everything you've ever heard, really take a step back and look again. Who is telling you this information? And sometimes go in the comments and see. There was this post that just went really viral by a creator talking about how folic acid is harmful. And it had a ton of views. Oh, I know. But if you do go into if you're a consumer, and that feels very confusing, if you go into the comments, you can see people clearly identifying themselves. I'm a board certified high risk OBGYN. I am a genetic counselor. I am a board certified OBGYN. And really read through that. And so that's one reason why I've been so passionate about having multiple avenues of educating people about really valid health information, because you have to meet people where they are. The truth is, in today's world, with access to so much technology and everybody's so busy, and the idea that, well, I'm just here and people can come find me if they want it, people won't find you, because the people who are not qualified to give health information are very loud, very sexy, very popular, and they are everywhere. So we have to be able to say, where is my target audience? Right? We share a target demographic, but who are you trying to reach? So similarly, if you're a healthcare professional and you want to educate on social media or on a podcast, I always say, well, who are you trying to reach and what platform are they using? Because that should be where you dedicate most of your time, right? If you're trying to reach a really young generation, we want to be on TikTok or YouTube. We don't really want to
Yeah.
be spending as much time on our older generation on
On
Instagram,
on
right?
face or
Facebook.
Facebook.
Yeah.
Yeah.
So really, there is some strategy to it, but the decision to go into just trying to educate it all is getting so frustrated by some of this misinformation that exists. And if you're not on social media, people are seeing, you see this in your clinical practice if you're practicing, right? All my OBGYN friends at this meeting I just talked at, and I put up the folic acid post, they're like, is this why every patient's asking about it? And it's like, yes. Like, your patients aren't trying to be difficult. Like, they are seeing this. They're coming to you to tell them that it's false. But if you are just so dismissive of it because it seems so crazy, that also doesn't inspire trust. So there's also a way for us to say, oh yeah, I saw that post. That was really popular. However, let me tell you why that's not true, and break it down really quickly for them. That's going to be a lot faster than letting them spiral thinking that you're giving them the wrong advice.
That's great advice because you're right. If you're not in the know, then it's hard for you to be able to re-educate them, and because they're like, oh, you have no idea what I'm even talking about. Um, I have to ask you too, because I take care of a lot of massive weight loss patients. And that can be an area that can be difficult. A lot of my patients, especially before they lost the weight, had a lot of issues with fertility. And then in the news, not too recently, they talked a lot about Ozempic babies. So what's the truth in all of this? That have an impact because of the medication itself, or is it due to weight loss? And that's why a lot of these ladies are then improving their chances of becoming pregnant.
Both things can be true at the same time. So, specifically for patients who've got PCOS, which is generally the population that is benefiting the most from GLP-1s, is going to be the patient who is overweight and they have metabolic consequences of their disease. So, we have to remember that polycystic ovarian syndrome is essentially a miscommunication between the brain and the ovaries. And the end result is that the ovaries are not regularly ovulating, but they're also making more male hormones. And that causes abdominal weight gain and insulin resistance and inflammation. And because of how GLP 1s work, not just on the weight loss spectrum, but also on the metabolic factors, it is. It has been revolutionary for some of my patients who have truly, truly struggled. So we see this reversal of some of their metabolic factors. We see a reduction in their weight. We know that fat cells, like to put it very simply, they make estrogen. That extra estrogen confuses the brain. So, in addition to some of the health consequences of being overweight and the pregnancy risks, it can make it harder for your body to interpret and send out hormonal signals when you have an increase in body fat. So, by simply losing that weight, it does improve the brain sensitivity and how it can interpret and send out hormone signals. So, we see an improvement in ovulation right away if that is one of the reasons why we're having difficulty ovulating, which for a lot of women overweight, it is. And weight loss has always been one of the top things you're going to recommend, but it is often before GLP-1 has been very hard to do to achieve in clinical practice, and often would take a really long time. And that's hard, especially if you're older, if you have infertility. The last thing you want to do is step away from your fertility journey, have to spend a year trying to lose weight to then get back in. The fact that we can see both a reduction in weight and a reduction in metabolic risk, because the metabolic factors are also very important for your fertility as well, meaning chronic inflammation and insulin resistance and gut health all impact hormone levels, implantation, healthy pregnancy. So the fact that we can see an improvement on both of these factors in such a short amount of time makes it feel a lot more achievable and result oriented to say, we're going to take a quick pause, go on these medications, try to lose some weight, and then revisit. And I've had some patients who maybe we'll do a little bit of treatment on and we're not getting the outcome we want, and they have PCOS and they are overweight. And we say, we're not going to try, we're going to go on these meds for 3 or 4 months, and then we're going to revisit. I should say we want you off of GLP-1s for at least 2 months before you try to get pregnant. So if you're doing planned fertility treatment, you'll see that we make you take a pause. Of course, because of the resumption in ovulation and the improvement in metabolic factors, we are seeing people get spontaneously pregnant who have years and years of infertility, which is incredible. We don't really think that they're harmful, but the truth is we don't know long-term outcomes on the placenta or on the fetus. So if you find yourself pregnant, just stop immediately and let your doctor know. But what we see is that these patients take 3 or 4 months on a GLP-1, do the same treatment again, and we have a huge improvement in success rates and outcomes. So it's a great tool in the toolbox. I think we're seeing, decrease in inflammation across multiple disease states. We keep seeing, I think, study after study come out showing, improvement in this cancer, improvement in
Or
dementia.
cardiac, or yeah, it's
It's
unbelievable.
incredible. So I think that that is all just really impactful. And I love having it as a tool for my patients.
Well, thank you so much for educating us on that. And, I think I'm very excited for your book coming out. I think that we definitely need more education like this. And I know that if you are somebody listening and this is something interests you, be sure to check it out. Please also be sure to check out Dr. Crawford's podcast or socials. She does such an amazing job of making into bite-sized pieces that you can understand. Um, Before we end, I do want to touch on some of your amazing work. I know you are a co-founder of not only your fertility clinic, but also the Pinnacle Conference. And so
Yes.
I would love to talk about that. We get so many women physicians who listen. Could you tell us what inspired you to start that?
Oh, thank you for asking. Pinnacle is incredible and it's changed over the course of the past 6 years. So, Pinnacle is officially what we call an education company for women in medicine. The goal is to provide both education and knowledge, but leadership skills, those resources for the business of medicine, the community that a lot of us didn't really learn about in medical training, but it's so important in real life practice. We have an annual conference every year. It's this coming up year, it's in Austin, May 1st through 3rd. It is one of the most inspiring events I've ever been to. You have people on stage speaking about their true life experience. We always say everybody walks away coming up with new goals and a new way to think about your life. The truth is, why it started, I got really burnt out from my first job. And in talking to some of my other physician friends, they had had a similar experience. And one of them said, we were all in different fields. She said, I wish there was a way for us all to go to a conference together and talk about and learn some of these things because I don't really connect with women in these different fields anymore. I just go to my conference. And so that was the nightest to have us start Pinnacle to say we really want this multi specialty organization because there are shared lessons and resources that we can all learn from each other. But now we also have our joint accreditation. So we're a true accreditation company, which means we can give continuing education for anybody else's. So, like if your podcast, if you'd love to give CE to your podcast, we can talk about that. But we have an app called Learn at Pinnacle, and it's completely free. And the talks from the conferences, podcast episodes, you can get free CE because I also think one of the things that burns us out is some of these outrageous amounts of CE that we have to get or not having resources for things that we want to do and not having, a way to hear other successful women talk or frame things. So you can download Learn at Pinnacle from the App Store and dip into the community. So even if coming to the conference isn't for you, it's a way to get connected with other women in medicine across every field and across every degree who really our goal is to say, hey, you can carve out your own place in medicine. We want women in medicine to stay in medicine. We want burnout to stop having fantastic people leaving the healthcare space. And how can we help support other women staying in?
Well, that is fantastic. And I know it is just grown and grown, and you have reached a lot of people. So you should be so proud of yourself for what you've done and created. And thank you so much for being on the podcast. And what is the best way, if any of our listeners want to be able to check you out, what's the most direct way for them to find you?
Thank you. Yes, I've loved recording. So thank you for having me. And you can find me on Instagram or TikTok at Natalie Crawford MD. You can also check out the As a Woman podcast on any podcast player or YouTube. And you also can check out the website, which is nataliecrawfordmd.com. There's information about the book there and the pre-order, but there's also a resources page, which I think is great because you can type in any topic and then you can find all the content that I've made, whether it's YouTube videos or podcasts or blog posts about whatever the topic is you're searching for.
Well, fabulous. Thank you so much again for being on the podcast. And thank you all for listening. And as always, I hope you learned something new.